Well, I thought maybe we could start with a mission. The mission of St. Peter's Health is to improve the health, wellness, and quality of life of the people and communities we serve. It doesn't say some people. It doesn't say people that have homes but not others. It says everyone.
FUSE stands for Frequent User Systems Engagement, and that is for clients that frequently use the emergency room or in and out of jail. Quite often, they're calling 911, homelessness, health concerns.
But there are just tons of resources out there, but trying to navigate through them is very difficult if you don't have transportation, if you don't have a phone, if you don't have a place to live to store anything. And in the end, the community is actually paying out more money to support this person out on the streets.
FUSE has a 20-year track record around the nation, and every study has demonstrated that by providing people with a safe place to live and the supportive services they need to maintain that the community saves money.
And the broader community pays closer attention because St. Peter's is saying this makes a fundamental difference in healthcare in terms of the quality of health outcomes for the individual we're serving, but also for the broader community. And that's what this is about. It's about let's do things smarter.
St. Peter's really has taken the lead as the champion. They're looking at here's what we can do from the healthcare side, and here's how we can allocate our community health workers. Then they work in partnership with those other organizations because ultimately you need all of the building blocks, but then you also need that connective tissue to kind of really hold it together. And that's what St. Peter's has been able to do. So the partners working in housing and the partners working with behavioral health and the partners working in law enforcement all understand that there is one goal and we're all kind of rowing in the same direction.
Former methamphetamine addict, lived homeless on the streets for a 4-year period. In a previous life, I was a shirt and tie guy, married, had kids, but there was always this backdrop of substance and as well as mental health, kind of in and out the door, 12-step programs. And when you really get lost in it, it becomes very overwhelming. And when you have the kind of a melting pot of issues that you need to address in life, to have somebody that can go, hey, number one, let me help you with your day-to-day things, but let's talk about what's going on. Community outreach, street outreach would have been really an invaluable service.
Community health workers have been one of the most impactful ways that we have seen people address housing as healthcare and FUSE. And unfortunately, they are not reimbursed in any way, shape, or form. So they are 100% community supported.
I do a broad variety of things. I mean, a lot of the things that I do with people is I'll help people, get food, help people look for jobs, help people look for housing. I'll accompany them to doctor's appointments. I'll accompany them to probation, advocate for them.
A lot of our clients don't realize that the help is there. So a lot of our job is just helping them navigate through the systems to find the supports that they need.
In fact, one of the scenes that I'll never forget is we were in the Our Place parking lot. There was one person in line who could not stand in line. He had a chair and he would move up 10 feet when the line moved, and he would move his chair and he would sit back down. And I happened to be watching that when I saw Colette, one of our community health workers. I could see her leaning over, talking to him.
It was on a Monday. I was down there at our place. She shows up, she says, oh, hey, she told me about how she could help me because I had a bad hip. And I was trying to get an operation done on it. And I was sitting down, she never saw me walk before. And she goes, oh God, yeah, we're getting you in. I had a real bad limp. On Wednesday, I'm walking from God's Love over to our place. Colette's already got everything set up through orthopedic to have my hip looked at. And I went, holy cow, that was quick. When I had my operation, the lady came in and hooked me up with an IV and gave me a shot and whatnot. I was in that room 5 minutes, I'm out. Next thing I know, I'm in a whole different room now. I had no idea what happened. All I realized was my hip didn't hurt.
It's one person, you hear the cliche one at a time, but we can really do something in this world if we work together.
That's what we're supposed to be doing, is helping people become independent, have productive lives. The amount of savings and just improvement that we've seen has been astronomical.
So far, at 9 months in, we are seeing an overall 59% reduction in emergency healthcare utilization. And so that includes mobile crisis response team, ambulance, behavioral health unit stays, inpatient admissions, the emergency department, and urgent care. And we're seeing an 82% reduction in criminal justice utilization, which includes Helena Police Department call for services and days spent incarcerated and how many bookings happened.
If it wasn't for Colette doing what she did, I'd still be out there. There's no ifs, ands, or buts about it. Because I gave up.
If you're somebody who has suicide ideations, or if you're struggling with addiction or any of that stuff, like just ask for help. Like that's the passion inside people that do this kind of work, or people that are in recovery, is they want to help people. Like that's what they're there for. And that's kind of where I feel my role is important, and where I can help is when a lot of times when people are down at their lowest, they just feel like there's nobody there to help them get out. And I can kind of be the person that says, hey, I know the way.
Ryan, without people like him, and I'd probably be dead right now, because I'd be on the streets and I'd still be drinking. I'm sure he has his own struggles and whatnot, but he seems so together, and like, wow, you were me at one point in time, really? I can do that? It's great. He's been a lot of help. It's nice to have somebody that I can openly talk to, that's been through the same thing, or, can relate that, hey, he did it. I can do it.
Never give up. Don't give up. You're worth fighting for. And that's one thing that I try to tell people is don't give up on yourself. Like, you owe it to yourself to have a better life.
This is by far the best job I've ever had. I just get to be out there helping people. I get to go out and interact with people and help them out and be their spokesperson, because a lot of the people that we work with don't really advocate for themselves, or it gets to be difficult and it's easy to quit.
I can't breathe through my mouth or nose. I only breathe through it. It's called a laryngectomy. I had to separate my mouth from my airway, so I breathe through my neck, and I still eat and swallow through my mouth. It's not fun and it doesn't feel good. I felt like giving up a few times, but I haven't. Because I don't want to give up, I don't want to die. I'm afraid of dying. Colette, and she helped me with my appointments and everything. She's like my real good friend. And helped me call in because I can't really call on the phone. It's hard to understand me with this electric voice. If they put me on speakerphone, might as well forget it.
What would your life be like without Colette?
Miserable.
I've had more than one, where I talk to them and they're like, oh, we tried this, we tried that, it didn't work, and so I just quit. And like one of the gentlemen, is homeless, and he needed lots of medical care, and he just wasn't getting it because he tried to make a few phone calls using other people's phones. Because he didn't have a phone of his own, nobody could call him back. So he just kind of fell on the wayside. And so as medical conditions get worse, then you can't work and you just continually spiral downward.
I think the one that kills me all the time is, why don't they just get a job? You can't get a job if you don't have a place to live. You can't get a job if you're addicted or your mental health is so bad. That's hard to explain to people. And if people have no experience with it, it's just like, it's foreign to people.
These are people who generally don't have people going to bat for them. And in fact, it's usually the opposite. It's people saying that guy or that lady, or, they brought this upon themselves. And so to try to point the finger doesn't help. For many people, that's what they need, is they need time. They need people to believe them and not give up.
It's people helping people. It's people not giving up on each other and someone taking chances on them. And they go further and further every time to take a chance on someone.
The reason I think that investing into things like healthcare for people who are unhoused or people with addiction or with mental health crises is so important, because it impacts so many future generations and it impacts for such a long duration of time. When you see someone who becomes sober for the first time, and then they're a present parent again, and their kids don't have as much trauma, and if they have a couple of kids, you think of the trickle-down effect of that. And study after study shows that the more trauma that you receive in childhood, the higher likelihood that you have of having a drug addiction yourself. So if we can stop the cycle of trauma and addiction, we really change the world.
Finally, for the first time in my life, I went to treatment again. But I really put some trust in the direction, and the direction led me to very fulfilling life, very fulfilling employment, and the opportunity to work with individuals that are going through a lot of the same things that I experienced in my life.
Going from doing all that for those 5 years of being homeless, and then all of a sudden turn around having a place, and I'm like, I don't have to worry about my hip. Where am I going to sleep tonight? Or what, am I going to get fed today? Where am I going to get food? It's a life changer. Oh yeah, big time.
I heard when I had to leave there. Made me cry. But I really cares about the people. There's no friends, and I talk to her a lot. I don't really know much about the Fuse program, but what everybody's done for me has been great. And I don't know what I'd do without them. I think it's a great opportunity for people. And there's a lot of people that need help. They can't do things on their own, like me.
It's working, absolutely. Yeah, we have this impressive data only 9 months into our pilot phase. So we're seeing impressive results with our 2 community health workers who do a great job.
No, I've pretty much come to terms with my mortality. I'm pretty okay with it. I mean, obviously nobody wants to check out, but if I do, I'm not scared of it. I don't want to go, but I'm not scared of it. Unfortunately, I got a head start on it because of my alcoholism. The doctor could tell as soon as I walked in that I was malnourished. It's not necessarily, a life-saving pill, but I can't afford to get the protein shakes. I mentioned it to Ryan. Ryan goes through the foundation, and now I got something that's gonna help me live showing up on my porch step a couple days from now. Just because somebody had enough and was willing to share. These people don't even know me. Why would you do that? Why would you care enough to donate? I mean, I killed myself. I did. And yet these people are nice enough and kind enough and wealthy enough to stop and think, yeah, that guy's life is worth saving. He wants to live, we should help him live.